I'm Cheryl Sanford. This is Nursing 205. I'm going to be giving Mr. Shepherd a piggyback IV of Rocephin. I compared the original order to the Mars and they are the same. He's going to be getting 1 gram IV once a day and 100 mils of normal saline to be administered over 30 minutes. He is getting a safe dose. The safe range is 1 to 2 grams every 24 hours, so his 1 gram once a day fits into the safe dosage range. Mr. Shepherd, I'm Cheryl, your nurse. I'm going to be here to give you some medicine. I'm going to perform hand hygiene. I'm going to sit this down. I'm going to shut this door real quick. I'm going to check your bracelet. Can you tell me your name and date of birth? Okay, James Shepherd, 8/31/1951. That's correct. Okay, I'm going to tell you a little bit about this medication. This medicine is going to bind to the cells of to the walls of the bacteria cells, and it's going to kill them. So it's going to help you start feeling better with your COPD exacerbation. So this medicine can cause some side effects, nausea and vomiting and headaches being the top ones. We're going to monitor you as a nurse for superinfections and diarrhea. We want you to report any side effects, burning and pain at your IV site, any of the nausea, vomiting, headaches, anything that makes you feel uncomfortable. It could be related to this medicine. We want you to let us know, okay? Alrighty, so we're going to run this at 200 mils per hour. And if we were going to do the drop factor, we're going to calculate that. And he's going to get it. So his drop factor would be 33 drops per minute if that's what we were going to do. And I'm going to check the MAR just to look things over real quick and compare. Okay, yes, he has the order for 1 gram IV to be administered over 30 minutes for 100 mils. I checked the compatibility between the D5 half normal saline and the Rocephin, and they are compatible. So we are going to get started. I'm going to go ahead and put gloves on before I get the medication out. And it says to give this dose at 1700, and it is 1700, so we are giving it at the correct time. So I'm going to check in my medication drawer. I'm going to get my tubing out, my medication. I'm going to sit in here for now. I'm going to shut this and make sure it's locked. Okay. And this medication came prepared from the pharmacy, so we don't have to mix it, and it's labeled there from the pharmacy. It says Rocephin 1 gram and 100 mils of normal saline to infuse at 200 mils per hour. And I'm going to scan this medication and scan his wristband to do a third check and just make sure that everything's okay before we start infusing. Okay, everything is the same. This medication expires May 2024, so it's not expired, so that's okay as well. And we got our tubing here, and I'm going to take these gloves off. I'm going to go ahead and perform hand hygiene again before we get started. Fresh gloves. And at this point, if you had to wear PPE, you would put that on or change it out as well. I'm going to take this and this. Hang this up here. I'm going to get this hook. We are going to lower the primary bag. Like so. I'm going to get our tubing out. Remove the cap here. We're going to remove the cap from the bag. We're going to spike it. We're going to clamp off our tubing. I'm going to fill this to the fill line. We are going to prime our tubing. Okay. I'm going to grab this alcohol swab. I'm going to clamp this tubing too. I'm not sure if I said that, but in case not, I'm going to clamp it. I'm going to get an alcohol swab. I'm going to clean this and this port. And also, I should have mentioned earlier that I checked his IV site and everything looks good. It's free and clear of redness. It's patent, and his normal fluids are running okay. So we're gonna connect this here. We're gonna unclamp this and unclamp this, and we would set our pump to run the piggy back at 200 mils per hour. So we are gonna do that. Is everything feeling okay? Okay, you don't feel any issues? All right. Okay, I'm gonna come back in about 30 minutes and we'll recheck it and make sure that everything's okay and that it's finished running and all of that. I'm gonna take away these, clean up my trash. I'm gonna perform hand hygiene. And I'm gonna go out. Knock on the door. I'm gonna come in, perform hand hygiene. All right, Mr. Shepherd, it's been 30 minutes. We are going to stop this from running. You feel okay? Alrighty. Get gloves on. We're gonna clamp this. And we're gonna remove it from here. And earlier I did not label my tubing, which I have a label here, and I should have done so because the tubing needs a label, especially if we're not going to throw it away based on facility, guidelines and protocols, because this particular facility lets them keep the tubing for 48 hours. So I should have done that as well earlier. But now we have that labeled, and this one was labeled as well already. So if you have any pain or anything like that, nope, okay. I'm gonna open this back up so your normal fluids are running at 100 mils per hour. So as long as you're okay, I'm gonna come back in a little bit and make sure you're not having any of those side effects that we had talked about, okay? Okay. Try my trash. I'm gonna perform hand hygiene. I'm gonna go out. I'm gonna come back in. Mr. Shepherd. Hey, it's Cheryl. I'm gonna perform hand hygiene. I'm gonna get my gloves on. And I just want to check you out, make sure your IV is still running okay. You're not having any nausea, diarrhea, no headaches. Okay, you feel good. Nothing, you don't feel like anything has gotten worse or anything since you've had the medication. Okay, check that your IV still looks good, everything's okay, and your fluids are still running. So as long as you're okay, we are good, and I'll come back in a little bit and check on you. Okay, gloves off, put my trash away. Perform hand hygiene. Oh no.